A beautiful smile is a reflection of not just aesthetics, but also the science and artistry of orthodontics. Behind every stunning smile, there is a complex interplay of biology and orthodontic principles that work together to gently move teeth into their correct positions. Orthodontics is a masterful blend of science and artistry. The science behind orthodontic treatments revolves around the principles of tooth movements, bone remodeling, and the application of controlled forces. As orthodontists work to create beautiful smiles, they use their expertise to craft personalized treatment plans and apply precise adjustments, transforming misaligned teeth into a harmonious and confident smile. Every stunning smile we see is a testament to the power of orthodontic science, a journey that starts with the vision of a beautiful smile and culminates in the science-based transformation of a patient's dental health and self-confidence. Today, on your regular Health TV talk show, The Physicians, we'll be discussing orthodontics, the science and arts of creating beautiful smiles.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another day with the Physicians, where your health is our business and will always be our business. My name is Dr. Martina Agbirie, your regular anchor on this program. Today we'll be discussing a very, very interesting topic. I'm already smiling. Orthodontics, the science and arts of creating beautiful smiles. And in the studio with me is our very, very cerebral, intelligent Dr. Ikenna Isiekwe. He is a consultant orthodontist and, of course, an associate prof at the College of Medicine, University of Lagos. Join me and welcome Dr. Isiekwe. Welcome to our program.
Thank you very much.
Nice having you with a beautiful smile too.
Thank you.
I'm so excited about this topic because I know very well that smiles, or people that actually smile are those that actually are proud of that denture, right?
True.
Okay, so now we're going to be talking about orthodontics.
Yes.
The science and art behind the beautiful smile. Yes. For the purpose of our viewers out there, what is orthodontics?
So,
you want to just give us a general overview?
So, in fact, your introduction was excellent, as it captured the essence of orthodontics itself.
Okay,
but to define it further, orthodontics, that term actually comes from two Greek words. Ortho, which means straight, and dontics, which means teeth. So, straight teeth.
Okay.
And so, in just in the simplest words, it's talking about having a beautiful smile. Okay. But if we wanted to go a little bit deeper, and orthodontics is that specialty of dentistry that deals with the prevention, the diagnosis, and treatment of poorly aligned teeth or misaligned jaws. So the layman will commonly see people who wear braces, and that term, braces, and what we call fixed appliances, and we use that to correct poorly aligned teeth or jaws. An orthodontist is a dentist who has undergone further specialty training. So you first have to be a dentist before you qualify to become an orthodontist. And that training period can range from 2 years outside the country. In Nigeria, it might take about 5 to 6 years to specialize to become an orthodontist after you have qualified as a dentist.
Okay, so for the purpose of our viewers out there, our guest is an orthodontist, which simply means he went to medical school, he graduated and had his MBBS.
BDS?
Yes, yes. Then he now went for his specialty in dentistry.
I went then the BDS and then the specialty in orthodontics.
In orthodontics. So you actually have to qualify first.
As a dentist.
As a dentist.
Before you qualify.
Before you qualify. Not the ones that we see in our streets that will just carry some things and tell you they are specialists, you can scrape and do all these kind of things. he is a professional. And he has told us the meaning of orthodontics and a general overview. So now let's talk about it. What do you do as an orthodontist? What is your work as an orthodontist?
Yeah, that's a very good question. We create beautiful smiles, and you ask me how, you know. To start with, our patients range from, we treat both children and adults. And essentially what we do is that we try to correct the poorly aligned dentition. And let me put it even in simpler terms. Some patients, there are children who come in and their teeth are not, they do not have a lovely smile. From the age of about 7, when we advise that 6 to 7, when we say you should take your child for regular dental checkups, you bring in the child, and the child has teeth that are not well arranged. They are maybe crowded, or the teeth are, shooting out. They look, they have like that buck teeth appearance, and the parents are worried. The orthodontist can intervene at that age. From the age of about 7, the child can start to get orthodontic treatment. Of course, the treatment for each patient depends on what the patient exactly has.
Okay, so before you start talking about the treatment,
yes,
we're not going to the treatment now.
Okay.
You're talking about the malocclusion.
Yes, malocclusion.
The way
yes.
it is
that is the right word, malocclusion.
Yes, there must be a reason for that. So what are the causes? Why? Because first of all, you already talked about a patient not having a lovely smile. The lovely smile you are referring to, is it as a result of how the teeth looks, or because the child is aware, or the individual is aware that he doesn't have a nice formation, in such a situation, just does not want to smile?
So your question is one that I'll try and break down in 2 simple ways.
Yes. The causes?
The causes of
And
malocclusion. So the commonest cause of malocclusion actually is hereditary. Even
hereditary?
Hereditary,
Are
yes.
you serious?
Yes. So it runs in families. So
wow.
The joke about, in my family, this is how our teeth look, or if this, the common one is the gap teeth. I know you're smiling. You have a lovely gap tooth.
Yes, thank you.
And in families, you say this gap tooth is our family identity.
Now that you're saying that, it makes sense, really.
So in Africa, it's a sign of beauty. But as in our world of orthodontics, the gap tooth is not a sign of beauty.
Okay, now you have talked about so many things, the possible causes, the risk factors, malocclusion here and there, lovely smiles. My audience want to know. So what are the possible management? How can this be taken care of?
So management is interesting, and as doctors, the first thing we talk about management is prevention. Before I even jump into the core things that we used to treat, the first thing we always advocate is prevention. Can we prevent some of this malocclusion from occurring? Yes. Making sure that children visit the dentist every 6 months, from the age of 6 to 7 years, that they avoid sugary things, because if a child loses the teeth, the baby teeth early, and it's not well managed, it can result in a malocclusion later in life. Then when we go to definitive treatment, of course, what the public commonly refers to as braces, these are appliances that we fix on the teeth of our patients to actually correct, to align. So some people sometimes misconstrue it to be a sign of fashion. But actually, we
have no idea what the patient is going through.
Exactly. So we have fixed appliances that we stick on the patient's teeth. These are brackets that we stick on the patient's teeth, and there are different types of these fixed appliances. But the public commonly refers to them as braces, and patients have to wear it for sometimes 12 months, sometimes 18 months to have their teeth arranged. We also have removable appliances that patients can put in their mouth and take out of their mouth. More recently, we are talking about things like we call aligners, that are invisible braces that patients can wear. Okay. It's important to note that our patients range from children to adults as old as 60, even 70. So people come on.
70-year-old.
Yes, 70-year-old patient. Yes, as long as there's no medical condition.
Smile.
Exactly. It's never too late to get a lovely smile. I've had patients that come to us and say, "Doctor, I've always wanted to do this," and then I've always wanted to correct the way my teeth look, and there's no age at which that cannot be achieved.
It is never too late to get a lovely smile. Yes. So now you're just talking about the possible management of this situation.
Yes.
So for those people, because we're talking about management now, you're also talking about braces and all those things. How affordable is it for people? Because now, because I need to consider other people that in other communities that can actually afford it. What are the other options available?
That's a very good question, and I think that's the question that we often I won't say that we struggle to answer, but in terms of costs, now, orthodontic treatment is often described as being expensive. And so affordability becomes a case of where you access care. So there are different places where you can access care. You can access care from a government facility, or you can access care from in our own environment, of course. People have the opportunity to access care from a government facility that has a specialist orthodontist in place, or you can access care from a private facility. Of course, care is cheaper in the government facilities. Private facilities it's much more expensive. So it's not, I wouldn't say it's exactly cheap because of the cost of the materials involved and the duration of treatment involved. Orthodontic treatment ranks as probably the most expensive, or one of the most expensive of all dental treatments that a patient can receive. But in our environment, it's highly subsidized at government facilities. So if you go to a government hospital that has an orthodontist, or provides orthodontic care, you will get it at a highly subsidized rates. And sometimes there are options to pay in installments, so it is also affordable. What we are advocating more and more is for it to be included in the National Health Insurance Scheme, so that more people can access care, even if it's via government or private facilities. There is increased access to orthodontic care, bearing in mind the costs involved.
Wow. Okay, so now let's quickly talk about for individuals, okay, that have some disease conditions. Okay. Do you have cases like that? Have you seen cases that, as a result of this disease condition, they not had a mal
Oh yes.
adjustment?
In fact, it happens, and that's one of the causes of malocclusions. Although it's a smaller percentage, but individuals who have tumors of the jaws. So there are certain tumors of the jaws that actually derange the alignment of the jaws. There are certain tumors of the jaws. Some of them are, I would say, benign, but they are slow growing. Some are rapidly growing, and they tend to disfigure the jaw, quote and unquote, such that the arrangement of the teeth, by the time the jaw, the teeth actually rest on the jaws. So if the alignment of the jaws is lost, it also affects the alignment of the teeth as well. So tumors like that can affect. In those cases, you have to manage the presenting tumor first before you now tend to manage the alignment of the teeth. And normally, for those cases, your primary aim is to control the growth of the tumor and arrest it and make sure it doesn't reoccur. After that has stabilized, then you will now want to talk about, aligning the teeth and then the jaws as well. And your question is also a very good one, because there are some cases that, it's not all cases, or it's not all patients that are amenable to just being treated with brackets alone, with fixed appliances alone, or removable appliances as the case may be. There are some cases where you have to do surgery to correct the alignment of the jaws, and the patients don't have any pathology. So there are some patients whose jaw relationship is so severe that we need to combine both braces and what we call orthodontic surgery to get a very good finish. So in some cases, it's a combination of both surgery and orthodontic treatment. We call orthodontic surgery and orthodontic treatment to get a very good finish, a beautiful outcome and a beautiful smile. Yes.
Okay, so now you have talked about all these things. Do we have possible complications that may arise when it's not treated?
When it's not treated?
Yes.
Well,
so it should be patient specific.
It won't be patient specific.
Okay.
Okay, let me tell you a very short story about. I have a patient, and her name, she had a lovely name called Pamela. Pamela means make me smile, and it's a very beautiful name. But Pamela was quiet, always quiet, and never talked in class, and the mother was worried. And when I started her treatment when she was about 7, she had a very wide gap between her teeth. And the mother was worried because she was tucking her finger and her teeth wasn't looking too good. And so we started Pamela's treatment, and we were able to correct the teeth, and she had a beautiful smile. And Pamela's attitude in the class changed. Pamela started talking. Pamela was interacting. Pamela's performance in school improved significantly compared to what it was before when we started treatment. And I'm trying to use this as a story to explain that even for children, when a child does not have that self-confidence to express herself, it even affects science. We have even shown, research has shown us that even teachers consider children that have well-arranged teeth to be more intelligent than those that do not have well-arranged teeth. And even adults, when they're employing staff and they look at the smiles, subconsciously, not that they are judging them based on their appearance, the human being tends to assume that that individual whose smile is better automatically. So what am I trying to drive at? That the complications, there are many social complications.
This should take us to talking about the prevention.
Yes.
So let's talk about the prevention so that you, for instance, those that still suck their thumbs, whatever thing that will make them have a poor dentition.
Yes.
So let's talk about the ways to prevent it.
Yes.
And okay, let's start from that question.
Okay, good. So I think basically for every aspect of dental care, and this is not just talking about orthodontics, it's important that there is a dental culture, you know, that we as a country, we are still behind in having that dental culture where, as a standard protocol, every family has a dentist that they go to, and they do not go to the dentist only when they are in pain. You know, the moment the child is born, I mean, you have a newborn baby, yes, the child may not be able to access dental care at that point, but by the time the child is 2.5 to 3, when all the baby teeth are almost there, you should start scheduling the first dental visit for the child, just to have a basic checkup, you know. And then beyond that, every 6 months, it should be a routine. Every 6 months, you know, both children and adults should see a dentist.
Parents actually have a role to play here.
Oh yes, a
But
very
I know
key role.
growing up as a child, my mom used to take us to the general hospital then.
Nice. Yes.
And the distance, we used to really, it was like a 35-40 minutes drive from my place to the general hospital. And she would always take us just for dental check. We didn't have any problem.
Lovely. That's
so we always look forward to going to
nice. And that's beautiful. So
at that time.
Excellent. And that's the ideal thing. So you build as a child, and you can see the difference. From the moment you were a child, you already were exposed to dental care. So it wasn't a new thing, and you weren't rushing to the clinic just because you had a toothache. But for most people, you know, that's not exactly the case. For several reasons beyond their control. There are not so many dentists all over the country, but we want to build the awareness so that at least where people can access care in cities or towns where you have at least dental facilities and then we hope that the health insurance scheme would also help to increase access to dental care. Yes.
Okay.
Yes.
So now, before I let you go, so just in summary, just tell us about care, dental care. When should it start? From childhood, using cotton wool.
So I think from the moment the moment the child is born, the mother has the duty of care to actually take proper care of, you know, even without teeth in the mouth, using the cotton wool to clean around the mouth, and then from the moment the first tooth is in the mouth, you know, to clean gently, exactly, and then using fluoride toothpaste is very important. Brushing twice daily as that child grows.
That emphasis, twice
daily, morning, yes.
Okay, now that you have said twice daily, is this a myth or not? Because someone will say you should brush after eating, or okay, so you brush after eating in the morning, then at night before you sleep. Then when you wake in the morning, you don't have to have your breakfast, but you can eat first before brushing.
Yeah,
is this actually...
if you brush last thing at night before you go to bed, and then you can have your breakfast and then brush after. It's okay. But if you didn't have if you hadn't brushed the whole day through, and then you're starting another day cycle, I mean that's not ideal. The idea of brushing twice a day is 2 key things. You want to reduce the plaque deposits and all the sugary stuff that have stuck onto the plaque in the mouth, you know, and then you want the fluoride release into the teeth because the fluoride is protective. Of course,
from the toothpaste.
Of course, the toothpaste also has antiseptic properties and all that.
Now you are going somewhere.
No,
now you're talking about using the toothpaste that has fluoride.
Yes.
How about those that use
chewing stick? So chewing stick, if properly used, is also not entirely bad. Because we know that, because if you come on TV and say that it's only those who brush their teeth with toothpaste and toothbrush that would have good oral health, will be lying. Many of our forefathers, even before, but the proper use of the chewing stick, it's not just leaving the chewing stick in the mouth and not cleaning, you know, that mechanical action of cleaning.
Charcoal.
And that's a difference. Charcoal is quite abrasive, so we need to watch what we use, because a lot of things are put in social media or in the public space as being ideal, but not all of them are ideal. Chewing stick we have found to be good if properly used, you know, so you have to use it properly and actually scrub each tooth. And we've also
actually treat properly.
Treat a pulp, exactly, and it's that pulp that you use to brush. And studies have shown that even the chewing stick itself contains some antibacterial properties.
Really?
So, I mean, our forefathers didn't get it wrong, you know, entirely, but science has helped.
Nature.
So science has helped, you know. The advantage that toothpaste provide when they are fluoridated is that fluoride is actually very effective in strengthening the teeth against
So we're still talking about the care before we round up. We're talking about the care.
Yes, so I mean, so basically, visit the dentist for adults at least once every 6 months.
Okay.
Once every adults or children once every 6 months. Have what I call a dental culture, that you do not go to the dentist only because of pain. You know, when you have when pain comes up, and then knowing the different being able to understand the different aspects of dental care, that is not just having extractions done, but that with technology that many things can happen, and that is expressed in orthodontics, where you can receive different forms of treatments to get a beautiful smile.
Well, thank you very much, Dr. Ikenna Isiekwe. I really appreciate your coming on our program, The Physicians. We have learned so much from you, and one thing that I want to take away from here is what you said. It is never too late to get a lovely smile. That's going to be my slogan. Never too late to get a lovely smile.
Thank you for having me.
I really appreciate you. And of course, we'll call you again to come and discuss some other very interesting topics to do with your field. And to our viewers out there, I just want to say a very big thank you for being part of our program today. You have heard all that the doctor said. Visit your dentist at least twice in a year. For mothers that have babies, as soon as you are able to take care of that child, when bathing that baby, use cotton wool. Just apply cotton wool in your hand with small lukewarm water and rub on the gum. Just massage the gum. It will help that child. Even when you finish breastfeeding is very good for the children. So it's also good to maintain a proper dental hygiene. For you as a mother, try as much as possible to also do the same. And give that lovely smile when breastfeeding the baby. Don't say because your denture is not, your dentition is not so good, you're not smiling while you're breastfeeding your baby. There is a connection between your smile and that of the baby when you're breastfeeding. I want to leave you on this particular word, like what he said. It is never too late to get a lovely smile. Smile. Don't let don't let that look put you down. Visit your doctor. They are available at the government hospitals. Book an appointment today. If you need to say, just have a care. If you have never been to a doctor before for a dental checkup, today is the day. Just book an appointment and go and see your doctor. Remember to follow us on our social media platforms, on Instagram, on Facebook, on YouTube. We have over 250 episodes there. You can actually binge on any one of them. If you want to be part of this program like Dr. Isiekwe, just a click away. Go to our website and complete the form. Just let us know and be part of our program. My name still remains Dr. Martina Agbere. Till next week, stay blessed and continue smiling.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.